Cohen. If you'll join us, please.
Thank you. I appreciate the opportunity to share with you. And I want to first start because this day has been a day that started with the reading of the Constitution, which is a document that we all revere. I have a little pocket copy of it right here. And we revere it. We pledge when we take our oath of office to protect and defend and support the Constitution. But we all know that it's interpreted by a Supreme Court, and it's more a Supreme Court history would have been better today for people to understand that. And you mentioned that the foundation of the particular health care bill is in the preamble, we the people of the United States, to form a more perfect union, establish justice, etc., promote the general welfare. Also, in Article 1, which is the legislative article, Section 8, it says that the Congress shall have the power to regulate commerce among the several states. And further, it says in Article 1 that the Congress shall have the authority to make all laws which shall be necessary and proper for carrying into execution the foregoing powers and all other powers vested by this Constitution of the government of the United States or any department or officer thereof. So in my opinion, I'm a lawyer, but there's lawyers on both sides. There's plenty of justification for this health care bill. Do you know next week when the Republicans will try to repeal this opportunity for Americans to get health care and to wipe out these pre-existing conditions, clauses, etc., will they be coming under the idea that the health care is not part of the general welfare? Will they be coming basically on a constitutional argument that they may make that this wasn't allowed to require a person to buy insurance, even though we can, of course, require a person to sign up for the draft and lose their liberty for a while and serve in the Army, and we can do that. We can conscript soldiers, but we can't make them buy insurance. Is that what they're going to say, or are they going to come and talk about these things that Mr. Scott talked about and say, we don't think that it's good policy for parents to have their children on their insurance till they're 26, or it's not good policy for women with breast cancer to get treatment at a certain what is their tactics, sir?
Well, I would assume that they'll try to go into their interpretation of the Constitution and avoid the very difficult argument of forcing or eliminating the patient's Bill of Rights and allowing the insurance companies to engage in gross discrimination based upon sex. Clearly, women are discriminated against by the health insurance company unless the patient's Bill of Rights is there to protect them. Similarly, the two examples that you gave, pre-existing conditions, I cannot imagine that they would even attempt to successfully, or even would be unsuccessful, argue that somehow these protections for the individual are not worth having. I think they'll go into some obscure interpretation of the Constitution. We'll see. It's going to be a debate on the floor. Unfortunately, there will be no hearings to precede that, and there will not be a discussion of the details.
And they will control the amendments that will be permitted to be discussed on this floor. I know Speaker Boehner said we were going to be able to have amendments and be able to have good discourse.
As you know, I saw you in Rules Committee earlier today. It's my impression that the Rules Committee is going to prohibit any amendments on the floor. We'll see. I mean, that has yet to be decided by Rules Committee. We don't know, but surely the one amendment I would propose is don't do it. Maintain the patient's Bill of Rights. Maintain these protections that we all need. There's not a person in this nation that is not subject to the possibility of an incident that would become a reason for rescission. That's my experience. 8 years hammering the insurance industry. You've got to honor your contract, yet because of the laws they were able to wiggle out of an expensive incident.
When I was a child, I had polio when I was 5 years old in 1954. I was fortunate my father was a doctor, and so sometimes professional courtesy, but I'm sure he had insurance that covered my hospitalization. But there were years later, I think it was 11 years later, I had a tendon lengthening operation that was immediately related to my polio and necessary on my Achilles tendon. That wouldn't have been permitted necessarily if they could have used a pre-existing condition such as polio to have denied coverage. And whether or not how my father dealt with the expense and whether it was because he was a physician, I don't know, but I'd hate to see children in the same situation and parents in the same situation not be permitted to get that type of coverage later on.
Well, I don't know if you remember Congress at the time, but we all, under this law, would have the same policy that every American would have. We wouldn't have any different policy than the American public would have. And the question about rescission, I mean, you're a prime candidate, should you lose office, which you shouldn't, to be uninsurable if the Patient's Bill of Rights were repealed. Under the Patient's Bill of Rights, if you were to leave Congress, you could get an insurance policy because the pre-existing condition that you have, polio, and an operation resulting from the polio would go into play as a pre-existing condition, and you would not be able to get an insurance policy.
Let me, if I can, read something that I had prepared for today. It came from a constituent's story, John Hopkins. And I know John Hopkins, and a very important and active citizen in my community and a contemporary. He sent me an email, and Mr. Hopkins requested I share this story with the House as we consider the repeal of the Affordable Care Act. I want to share it with everybody here on C-SPAN. John was diagnosed with 2 unrelated cancers during his life. If you know anything about cancer, getting it twice for unrelated reasons is almost unheard of. But it happened to John Hopkins. Midway through his first bout with cancer, he was, of course, dropped from his health insurance plan. He was left with a medical bill that wiped out his and his wife's entire retirement savings, as well as the value of their house. They were never able to repay the debt in their lifetime. When he was diagnosed with a second bout of cancer 2 years later, he had no health insurance because there was no insurer anywhere in the market who would offer him a policy because of the pre-existing condition. He got some coverage in Tennessee because of a plan called Access Tennessee for uninsurables, but it was limited to $250,000 a year. As we all know, annual limits are set to be phased out by 2014 because of this law, and lifetime limits are already a thing of the past. $250,000 may seem like a lot of coverage, but when somebody needs something like a bone marrow transplant to cure their leukemia, that single treatment would exceed the annual cap. My Republican colleagues have decided their first priority as the new majority will be repealing the Affordable Care Act. And when they vote to do this, they will be voting for the following: denying Mr. Hopkins the ability to enroll in a health insurance plan that doesn't discriminate against him for daring to be diagnosed with cancer again. They will deny John Hopkins the ability to enroll in a health plan that will actually continue to cover his treatments after he exhausts a current annual cap of $250,000, an amount that many cancer patients meet in a matter of weeks upon diagnosis, let alone those who are fighting 2 cancers over a number of years. And they will send a message to John Hopkins that every other single American who's ever been diagnosed with or will ever be diagnosed with a disease like cancer, that they're on their own when it comes to coverage. That sure, they're free to get treatments and meet with their doctors, undergo laborious and life-saving surgeries year after year, just so long as they can foot the bill or try to keep it under the annual cap. Because when it comes to cancer, budgeting your treatment should surely take precedence over everything else, right? Mr. Garamendi, I'm ashamed that we're even considering the repeal of this affordable health care bill. And when I see these numbers, about $250,000, and I think of the fact that the Republicans were against any caps on insurance, on taxes, they realize $250,000 annual income in many places is a middle income salary. But for limitations on health care, they think the insurance company should determine that, and that's enough. And if you've got cancer, it's not enough. Another friend of mine Facebooked me, Jimmy Barrasso. Jimmy worked for a long time for a company in Memphis. He's always been successful. He lost his job with that corporation because he had high cholesterol. He had difficulties getting insurance, and it took him a long time to find private insurance because of that pre-existing condition. He just sent me this on Facebook. He was friending me, and he mentioned it, and I wanted to relate it. There are so many people in this country who are getting benefits and will get benefits, and many of the benefits don't go into effect until 2014. And the idea that this Congress, the 112th as its first act, would do such harm to the general welfare and the American public is hard to fathom, sir.
Mr. Cohen, thank you so very much.